Good morning, everyone. So today's talk is on routes of drug administration. Uh, Myself, Dr. Irfan Ahmed Khan, and I am working as assistant professor in the Department of Pharmacology and Medical College, and I am also looking after the work of the Adverse Drug Reaction Monitoring Center of JN Medical College. So, what are the different routes? So basically, before going into details of the different routes, two terminologies are very important. One is the dose. So what is actually a dose? Dose is the dose is the amount of the drug which we are going to give to the patient, and it is the amount. And next important terminology which we should know before going ahead is the dosage form. Dosage form means the form in which the drug is being administered. So there are various dosage forms which can be classified as solid, liquid, or the gaseous one. In the solid one, we have the unit solids such as tablets, capsule, and the other is the bulk dosage forms like powder or the dusting powder. Then in between the solid and the liquid, we have the semi-solid preparations such as cream, pastes, gel, suppositories. The liquid dosage forms can be monophasic or biphasic. The, the monophasic ones are the syrup, the solutions. The biphasic ones are the emulsion, suspension, and the last dosage form is the gaseous ones, which we use in through the inhalers or in the aerosol form. So these are the different dosage forms. So this is a tablet strip of morphine sulfate. The trade name is written over here, and 15 milligram. That means the each tablet, the dose is 15 milligram. So each tablet contains 15 milligram of morphine sulfate. So in this strip only we see that there are the dosage form is also mentioned over here. That is, it is tablets. So coming to the classification, what are the different routes of drug administration? The different routes of drugs have been divided into enteral, parenteral, and the topical ones. So coming to one by one, the enteral route of drug administration, which includes the oral, sublingual, or the rectal route. That means the drug is being applied, or the drug is being administered to any part of the alimentary canal, right from the mouth to the anus, the drug is being administered. So this forms the enteral route of drug administration. The other one is the parenteral, that is apart from the enteral. That means the drug is not being applied to any part of the GI tract from and beyond it. That includes the parenteral route, which includes the different injectable forms such as intravenous, intramuscular, subcutaneous, intradermal, intracardiac, intrathecal, epidural, intracardiac. Then the other form of parenteral route of drug administration is inhalational route, where the drug is being administered to the lungs. And the next is the transdermal route. And apart from this is the topical route, where the local topical application of drug is being done. So what are the different factors which govern the choice of the route? So there are certain factors by which due to which we are going to choose a particular route of drug administration for a particular drug. So the factors, the most important one is the drug characteristic. What type of drug it is, what is its pharmacokinetics, what is its absorption, what is its bioavailability, what is the dosage form of the drug. It governs the route which we are going to choose for administering drug. Suppose so second is the ease of administration. The best is easiest method should be chosen for administering the drug. The other is the site of action. What is the site of action? Whether we want a localized effect, whether we want a generalized effect. So based on that also we are going to vary the route of drug administration. Suppose you people are dental people, you have to administer local anesthetic for an extraction of tooth. So so for that purpose you are going to administer this local anesthetic in a by local infiltration method. So that changes our route of administration. And if suppose the same local anesthetic is to be used for giving a spinal anesthesia, for making the limbs anesthetized, so for that we are going to give it by spinal route. So based on our need or the action, how much we want, uh, our route of drug administration is also going to change. Then onset of action, whether it's an emergency condition, we want the immediate effect of the drug. So based on that also our route of drug administration varies. As if we are going to give a drug by intravenous route, the onset will be immediate. So if we are in certain emergency, or we are in some we are in the emergency place, so right over there, suppose if a patient is having some critical illness which is very which requires immediate action, so the drugs will be administered to those routes which will have the quickest onset of action. The other factor is the duration of action. How much duration we require the drug to be in effect. So based on the uh, acute illness or the chronic illness, so based on that also we are going to change the route of the drug administration. Then the quantity of drug administration, whether we have to give a small dose of the drug, whether we have to give a larger amount of drug. So based on that also we have to we are going to vary or change our route of drug administration. Then there are different diseases such as liver diseases or kidney disease or comorbid conditions which also govern the route of drug administration. Okay, somebody wants to ask some question. Should I move ahead, or somebody raised hand? He or she wants to ask some question. Okay, no problem. I will be moving ahead. In the end, I will be taking up questions if you are having. So coming to the enteral route, that means the drug is being placed directly in the GI tract. So it includes the sublingual, oral, and the rectal. In the sublingual route, the drug is being placed under the tongue. Oral, there is swallowing of the tablet or the powder or the syrups. That is per oram. PO stands for the per oram. And the other is the rectal route where the drug is being applied uh, through the rectum. So coming to the oral route, there are certain advantages of the oral route. We take tablets and the powders with the help of water. So the advantages of the oral route is it is very safe, easy to administer. That means it is a convenient method, economical, as we do not require any sterilization of the instrument or any technical application. Simply we have to take the tablet, and it is use it usually has good absorption and can be self-administered. So we do not require a second person help for the administration of the drug. What are the disadvantages? The disadvantages of the oral route are that it has slow absorption. So the onset of action will also be slow. So if we require quicker action, so we do not we have to avoid this route of drug administration. We cannot administer the irritable or the unpalatable drugs or in patients who are uncooperative or unconscious. So for them also the oral route is not preferred. And certain drugs such as having proteinaceous nature, such as insulin. We cannot administer it orally because it will get digested in the GI tract. Then the first pass effect. That means the drug taken administered through oral route, it after absorption it reaches to the liver where it gets metabolized. So after before reaching the systemic circulation, so only a certain percentage of the drug reaches to the systemic circulation. So the first pass effect is there, and it also is so we have to give a larger dose of the drug to make it systemically effective. Next, we have the sublingual route. The advantage of sublingual is it's economical. Quick termination can be done. Suppose a patient is having angina, we take nitrates by sublingual route. Then, after the pain is subsided and we have the tablet left in the sublingual below our tongue, so we can spit out the tablet. And this by this route, the drug gets absorbed into the circulation. So first pass is also avoided. So lesser amount of the drug will be required, and the drug absorption is also quick and it is self-administered. So these are the advantages. Disadvantage of the sublingual route is that the unpalatable or the bitter drugs cannot be taken through this route. Irritation of the oral mucosa can occur with the drug. Large quantities cannot be taken, and only a few drugs are there which can be absorbed through the sublingual route. Third enteral route is the rectal route. The advantage of the rectal route is that it is a common method used for administration of drugs in children, where and it has little or no first pass effect. And for patients who are having vomiting or unconstitution, rectal route can be used, and high concentration can be rapidly achieved. So, for febrile seizures in children, diazepam is commonly being used by the rectal route. The disadvantage with this route is that it is inconvenient, absorption is slow and erratic, irritation or inflammation of the rectal mucosa can occur. So coming to the systemic route, the first pass metabolism can occur with the oral route of drug administration. So if a drug is being administered through the systemic route, suppose we are giving a drug by IV route, then the drug is directly reaching into the systemic circulation, and which has the access to rest of the body. So we require a lower dose. While when we administer a drug orally, so the drug after absorption reaches to the liver where a certain portion of the drug gets metabolized, and what we get in the to the rest of the body through the circulation further ahead is a lesser amount. So we require a higher dose to be given by the parent oral route. So that is what first pass metabolism is. So what is the technique of administration of the drugs by the parenteral route is that for the intradermal route we take an angle of 15 degree, and for the subcutaneous it is 45 degree. For intramuscular route we have to inject it in the 90 degree, and for the intravenous route we have to administer it in the vein. So coming to the intravascular route, it is having the 100% bioavailability. That is the fraction of bioavailability, that fraction which reaches the systemic circulation directly. So since we are giving the drug directly into the vein, so we are achieving 100% bioavailability. So we have a precise, accurate, and almost immediate onset of action. So for the emergency condition, this is the best route we have. And then for the large quantity of drugs to be given and fairly pain-free, since we have to just puncture the vein and we have to put the intracat. and larger dose by the IV infusion can be administered over a period of time. And bolus, IV bolus also, we can administer larger amount of drug immediately also. There are greater risk of adverse effect associated with the intravascular route since high concentration is attained rapidly and we cannot take out the drug. There is risk of embolism and the drug cannot be recalled by strategies such as MSCs or by binding to activated charcoal. In the oral, we can induce MSCs or we can use activated charcoal to decrease the absorption of the drug if we have certain adverse drug reaction. But with the intravenous route, we do not have this advantage. And these are useful for drugs that are not absorbed orally. For the bitter drugs, we can use the intravascular route. Next route is the intramuscular route. So the advantage is that the absorption is reasonably uniform. After intravenous, the better absorption is through the intramuscular route in the parenteral form of drug administration. And then there is rapid onset of action for drugs in aqueous solution. There is mild irritant drug can be also given. So we can give repositories of slow release preparations, such as for the progesterone, we have the preparations which are administered as depot preparations, and the effect lasts for longer period. And first pass is also avoided, and the gastric factors can also be avoided. The disadvantage is that we can administer to a maximum of 10 ml by intramuscular route, and there are chances of local pain, abscess formation, sterilization is required, so it is expensive. Infection can occur, or nerve damage can also occur by the intramuscular route. The other parenteral route is the subcutaneous route. So one of the very common hormone given by the subcutaneous route is the insulin, and here the drug is injected under the skin, and absorption is slow, so the action can be a prolonged duration. So we have certain implants also where tablets or certain capsules, they are inserted into the tissues by incision of the skin, and then they are still, the example are the certain hormonal drugs like the Norplant we have for prevention of the contraception. Then we have the dermojet. Dermojet, what happens that there is a high pressure of air where no needle is required and the drug gets deposited beneath the skin, and from there is slow absorption of the drug. Coming to the intradermal route, it is very commonly used for hypersensitivity testing and for inoculation of the BCG vaccine, where in the intradermal route, the drug is given within skin layers, dermis. It is a painful procedure. There is bleb formation, and mainly used for hypersensitivity testing, such as for penicillin or for administration of the BCG vaccine. Next is the parenteral route, is the inhalational route, where the drug in the aerosol form, both the gaseous as well as the volatile agents are administered to the lung. Through inhalers are used for formation of the aerosol, and there is rapid onset of action due to rapid access to the circulation. There is rich circulation in the lung, large surface area, thin membrane separating the alveoli from circulation, and high blood flow in the lung, which provides a rapid onset of action of the drug. Then we have the topical routes, where the drugs are absorbed from the mucosal membranes in the form of eye drops, nasal drops, antiseptics, sunscreen, vaginal creams. Then there are drugs applied directly on the skin, on the dermis by rubbing of the oil or the ointment for the local action, or transdermally, the drug is absorbed through the skin, and the drug is going to produce the systemic action. So this is a transdermal patch which is applied on the arm. So that commonly We use the nicotine patch is there. Then we have the painkiller patch. Then the nitrate patch we have for nicotine patch is used for cessation of smoking. And what this patch actually contains, the patch is having a backing, then there is a drug reservoir, then there is a membrane which causes a slow release of the drug, then there is the adhesive layer which is adhered to the skin, and slowly from this drug reservoir the drug gets goes on being absorbed uh, through the skin and reaches to the blood, and the drug diffuses from this reservoir into subcutaneous tissue and then into the circulation slowly and slowly, and produce the effect for a longer duration. So that was all about the different routes of drug administration. So if you want to get the PPTs, most probably I will be sending you through your email also these PPTs and this video also, and you can download these videos also from the AMU website. If you can directly Google my name, and you can come to this page also. If you click over here, you can come to this page, and from here the download there is written, click here to download the study materials. You can get the study materials also directly. So I will be uploading within today or by tomorrow. I will be uploading these PPTs also and the video also, and most probably I will be sending you through your mails also. So if anybody is having any question, I will be more than happy to answer it.